So I'll be touching on bioidentical hormone replacement therapy. May I know how many of you all are already practicing BHRT? Anyone? Okay. Okay, so I'll just do an overview about aging, right? So it's all a natural process of aging. Aging is inevitable. And what are the factors that actually causes aging? There are multiple factors. But what we're going to focus on today is on the hormonal, okay? We'll touch on BHRT. So this is a fun fact. So which gender ages faster? So studies have shown that to the age of 50, both men and women age at the same rate. However, once 50 and above, the men, they age better, slower. So they lose their collagen gradually as compared to women. So once we hit menopause, it's an accelerated aging. Okay, so we age actually 3 times faster than the men. Okay, it's quite unfair, right? So hence we tend to do a lot more aesthetic procedures. So coming to menopause. Now menopause, it's a natural transition that takes place in women. Now from perimenopause to menopause, it takes about 4 to 10 years. An average about 4 to 5 years. So what actually influences this duration? It all depends on genetic factors, our lifestyle, and also the age of when we are diagnosed to have perimenopause. So you can see there's all the symptoms that actually takes place. I won't go into the andropause, but men, they have a similar thing. And studies have actually shown that about 70 to 80% of men, they are unaware of menopause, andropause. So are they in denial? So nobody likes aging, but these are the things that actually takes place. It affects everything, right from our head to our toes. Now aesthetics, we tend to do all the aesthetic procedures from the external, but what happens is when you combine it with bioidentical, you get an excellent result, because bioidentical, fixing the hormones from internal is the beauty from within, okay? So these are all the changes that takes place as we age. Changes on our body, and coming to our bone. So we lose our bone density. So once we start to lose our bone density, that leads to osteopenia, osteoporosis. Hence, it increases the risk of fractures in the elderly. And women, we tend to lose about 3 to 8% of muscle mass. So especially once we are 35 and above, and it increases rapidly once we hit 50 years and above. So all these, losing the loss of the bone density, leads to the loss of height. So coming to all the changes, so we can address on the aesthetic, on the external, but combine it with the BHRT, we get a very good results, right? That's beauty from inside out. So I'll be touching on this later part, when you talk about when there's a decline in the hormones, between the two, we tend to lose progesterone more drastically compared to the estrogen. And when that happens, women, we tend to suffer from female sexual dysfunction. So a lot of women, when you talk about premenopause to the perimenopause, even in their prime years, studies have shown that women, they tend to have low libido. So about 43% of them, they tend to suffer from this, okay? So what are the symptoms that a woman tend to have when they are in perimenopause? They tend to have a lot of them. They have anxiety, they have sleep issues, they tend to be fatigued, hair loss, weight gain. So their metabolism tends to decrease. Okay, I won't go much into the men because I think Dr. Sashi has already touched on this. Well, they as well, they tend to go through what we call it as andropause. Even their testosterone levels tend to decrease. So the growth hormone, so once we're 35 and above, every decade it tends to decrease by about 15%. Now when the growth hormone, when it decreases, there tend to be some changes in our bodily function. So our energy declines, our muscle mass also declines, and even our metabolism decreases that leads to weight gain. So similarly to growth hormone, I'll be focusing on the female hormones now. So there tend to be a decline in our hormones. Okay, so it's the pointer. So when we look at our estrogen, so you compare this slide, the estrogen and the progesterone. So the progesterone, it declines rapidly as compared to the estrogen. So when a woman is in a perimenopause stage, the progesterone decreases, and they tend to have irregular cycle or prolonged bleeds, which is actually very common, as well as anxiety. So with this decline in the progesterone, it makes a person estrogen dominant. Now, what are the causes of progesterone that decreases? It could be due to chronic stress, polycystic ovarian syndrome, I'm sure you'll see that in your clinical settings, and also underactive thyroid or hypothyroid. So this is a very common condition. I think almost a lot of my patients that I see, when we do a diagnosis, we do the lab analysis, and a lot of them are actually sitting in underactive thyroid. So that's the time that we need to address, rather than extending the help once they become fully blown hypothyroid. So as I mentioned, once the progesterone decreases, it becomes estrogen dominant. So now estrogen dominant, it also causes you to the xenoestrogens. So xenoestrogens, as we know, we tend to see around the environmental factors due to all these talents that you see, the plastics, pesticides. The other causes are basically when you talk about the gut health. Gut health is very important. So when the detox, when we have poor detox function, then it leads to estrogen dominance, as well as stress, and we mentioned about hypothyroid, and they use a lot of oral contraceptives. So testosterone. So women, we also require testosterone. We require it in a small amount, but that small amount is very potent. It makes a profound impact on our health. So it goes beyond the libido. It's very important for our muscle mass, our, when we talk about the bone density. So it maintains the bone density, it reduces the risk of osteopenic, osteoporosis, therefore leading to the risk of fractures. And for women, we also require it for energy, when you talk about cognitive function and our mood, it plays an important role. So this basically just shows us the decline of our overall hormonal decline. So right from the first that actually dips, as I mentioned just now, is the progesterone. Then the estrogen is a bit more slowly. It's still present at about, in the late 40s to 50s. But even the testosterone, DHEA, tends to decline very much early. And melatonin is basically the most natural sleep regulator. It's important to supplement with this. I mean, it's something more natural as compared to the others. And just a note on melatonin, most people think that it's only for sleep, it's for jet lag, but melatonin is a potent antioxidant, it's good for your skin, very important to boost your immune system. So for those patients who are diagnosed with cancer, we tend to give them about 150 to 200 milligrams per day. Okay, so coming to the hormones, as we know that hormones is basically it's a chemical messenger that is secreted by our endocrine glands directly into the blood, and then it goes and exerts its effect on the tissues as well as organs. Okay, and the kind of hormones that is actually produced by our body is just a physiological amount. And any changes in this, a small amount, whether it's too much or too little, it can cause hormonal havoc, especially in women. Just an overview, this is our endocrine system, we don't need to go much in details. So coming to bioidentical hormone replacement therapy. So BHRT is basically, it's bioidentical. Why do we call it bioidentical? Because it's isomolecular. So the bioidentical hormone is actually derived from soy, it's derived from yam. And what we actually compound, when you say isomolecular, it's similar to what is produced to our body. And why is this better than any HRT? It's just we require a very low dose, and it's also better binding to our receptors in the body. So this is just a structure to compare when we talk about the molecular structure. So this is the human progesterone, and now when you look at the bioidentical, which is derived from the soy and yam, it is isomolecular, it is kind of identical. As compared to the synthetic, this is Provera, it has additional carbon atoms, hydrogen atoms. So I've been practicing BHRT since 2008. Now, in my experience, I can only speak for my experience, is basically as long as you prescribe it judiciously, please get yourself trained, you won't face any issues. Okay, so when we talk about bioidentical, it's actually, we are talking about preventing of the chronic diseases. What we actually see is every time is just at the tip of the iceberg. So conventional, once you hit menopause, that's when they will dish out, they will give all the HRT. But when you practice bioidentical, we tend to prescribe from the stage of perimenopause. But all this, I'll come into the details about doing the comprehensive blood analysis, hormonal assay, so to always to be safe and to protect yourself. Okay, so when we say proactive, essentially we are preventing, right? And the thing about the bioidentical is not to say that you don't grow old, but yes, we will, when we age gracefully and we slow down the process, but more importantly, essentially the quality of life. Okay, so it covers everything, right from your hair, mental health, mood, your memory, bone health, libido, sleep. It covers everything. I won't go into the details, but as I mentioned, it just covers everything. Improves your energy. Overall, it's just the quality of life. We are more productive. Okay, so this I already mentioned: weight loss, energy, your sleep, digestion. This goes beyond the libido. So with this, we can actually age gracefully. So the bioidentical, it's basically, we don't believe that, when you talk about conventional HRT, that it's just one dose. When it comes to BHRT, we don't believe that it's one size that fits all, because we are all unique individual. So all this is personalized, it's tailor-made after a thorough examination, a thorough history taking, getting a comprehensive blood profile that includes hormonal assays, interpretation, and then you sit down with your patient and you just go through, come out with a program to help goals. Okay, hormones is just part of it, but I'm always an advocate for the 5 pillars. Always address the gut health, never forget that. All healing starts with the gut, and then you just address whatever that is, whether it's deficient, subclinical, according to the hormonal assay, or it includes the nutrition. So the gut, the nutrition, the vitamins, the minerals, the stress reduction, and exercise, very important. So as I mentioned just now, it's basically how is it prescribed. We just do a thorough history taking, physical examination, and when you talk about the hormonal assays, we go into the details, the estrogen, the progesterone, FSH, LH. We look into the thyroid to include the 3T3, just not the T4 and the TSH, IGF-1. We look into the CRP because we need to address if there's any inflammation, address target where the inflammation is taking place, address gut health. Homocysteine is very important. The vitamin D is also very important. Okay, so all those needs to be included. Now these are the commonly asked questions, right? Frequently asked questions. So can you take it on the long term? So from my personal experience, the longest has been about 10 years. And the patient, they say that they want to stop even after 5 years. You can always stop it, you can monitor. Is it going to do any harm to the patient? No, because when you do a baseline of all this hormonal profile, we have that as a backup. So once when they stop, it's just going to go back to baseline. It's not going to cause them any harm. And when we prescribe, we always prescribe a physiological dose, low dose. Never prescribe any supraphysiological dose, because that's when the complication will arise.